From the Southwest Network of Radio Nigeria, the time is 2 o'clock.
Good afternoon. Welcome to another edition of The World Today. It is a Southwest Network program of Radio Nigeria, but a zonal station comprising news, feature, and sports. In the lineup, experts identify staff shortage as cause of medical mishap. Police apprehend teenage armed robbery suspects. On the foreign scene, interim Venezuelan leader plans to visit U.S. Military intelligence cautions against drone drifting to Finland. Heart of the matter today is on addressing medical negligence. I am Redmi Omolola. Reading with me this afternoon is
Stephen Agbaje. Thank you for joining us. You can also listen on live stream via www.radionigeriaibadan.gov.ng or watch us live on Facebook at Premier FM 93.5. Shun any act that could trigger fire outbreak. Now the news in detail. In recent times, there have been recurring cases of avoidable mistakes in medical practice within Nigeria's health sector, popularly referred to as medical negligence. In this special report, our correspondent Lillian Ibomo beams a searchlight on the possible causes of these malpractices and the solution. Her report.
Medical negligence refers to a situation where a healthcare professional fails to meet the acceptable standard of care, resulting in patient's harm, injury, or death. When such failures attract legal actions, they are often described as medical practices. The term broadly covers situations where medical professionals failed to meet expected standards, sometimes due to simple but avoidable mistakes. Common examples of medical negligence include carelessness, misdiagnosis leading to medication errors, surgical mistakes, negligence during prenatal care or delivery, anesthesia error, and failure to obtain informed patient's consent. Recent high-profile cases of medical negligence in Nigeria include the death of the son of renowned author Chimamanda Adichie in Lagos, allegedly linked to oxygen denial and sedation issues, as well as the death of Aishatu Umar in Kano, where surgical scissors were reportedly left in her abdomen. This incident sparked national outrage. In addition, a Lagos resident has filed a lawsuit against a hospital over alleged urinary damage. These cases underscore persistent challenges in clinical governance and have renewed calls for improved standards and accountability in the health sector. Speaking on the causes of medical negligence, a UK-based medical practitioner, Dr. Emmanuel Ewogu, attributed the problem to systemic issues such as underfunding, staff shortages, and poor infrastructure, which he claimed often lead to carelessness in healthcare delivery.
Whenever I see those kind of stories accused of negligence, I want to know the full story. I want to know the working conditions under which that person worked that predisposed that person to missing things or not being able to complete things as sufficiently as they should. The system predisposes you, the worker, to danger by providing an unsafe environment. Does that make sense?
Dr. Ewogu added that the situation is further compounded by patient-related factors such as poverty and low health literacy, which make reporting cases and pursuing litigation difficult despite existing laws. A cross-section of residents of Ibadan blamed the rising cases of medical negligence in Nigeria on quackery and the continued brain drain in the health sector.
My view is that it's wrong. How can a doctor forget scissors in a woman's womb? Didn't you know that it's a scissors? A big scissors for that. I think it's a big object.
Most of the people that we are seeing, they think a lot of things. Maybe because of this situation of this country.
Most of these people, they might not really be a professional in nature. They might have the opportunity of working in such organization, maybe as a result of maybe connection or so. It's a sad situation.
The residents urged government to urgently address the issue to prevent further loss of lives. Meanwhile, a community health officer at Akinyele local government area of Oyo State, Mr. Tunji Oloyede, said just like in every other profession, there are sanctions for mistakes in medical practice that could be applied to prevent recurrence in future.
by placing high discipline on anybody found guilty, by prosecuting the person. As a medical personnel, you know the right thing to do, and you fail to do it. The body, either NMA or NAN, that's a nursing council or community health council board or health information management board, they can withdraw that person's certificate.
Mr. Oloyede noted that medical negligence remains a serious health issue that requires urgent attention as it directly concerns the safety of human lives. In Ibadan, Lillian Ibomo, Radio Nigeria.
An intern from the University of Ibadan, Oyo State, Mercy Elam, in today's Heart of the Matter, writes on addressing medical negligence.
Nigeria's health sector witnessed another uproar 7th of this month when the news broke about an author, Chimamanda Adichie, who lost her 21-month-old son, Nkanu, at a Lagos hospital, with the writer accusing doctors at the hospital of negligence. Mrs. Adichie said Nkanu was not given oxygen as he experienced a crisis leading to cardiac arrest. Shortly after the Adichie episode, a Nollywood actress, Toyin Lawani, accused the same hospital of putting her into a medical ordeal after a spinal implant, which cost her 100 million naira. A few days later, another tragedy occurred in Kano State, which was reportedly caused by negligence. A mother of 5, Aishatu Umar, died after surgery at the Abubakar Imam Urology Hospital as doctors allegedly forgot scissors inside her body. Mrs. Umar suffered severe pain for 4 months after the initial surgery, leading to a corrective surgery that instigated her death. Indeed, several complaints abound about the health system, which can be attributed to poorly trained, underpaid and ill-motivated medical doctors, nurses and health workers are central to these crises. Poor oversight by health authorities, coupled with corruption, encourages unqualified persons to serve as medical practitioners in various CD locations. Even in the registered and high-profile hospitals, misdiagnosis has claimed lives, resident doctors doing as many as 100 hours per week, which negates the British Medical Association recommendation of British doctors work a 48-hour shift per week. The doctor shortage ratio ranged from 1 doctor per 3,333 patients, which falls far below the World Health Organization WHO's recommendation of 1 doctor per 600 patients due to significant brain drain. Successive federal administrations have also failed to meet the Abuja declaration of allocating at least 15% of their annual budgets to the health sector. A sum of over 2 trillion naira was allocated to the health sector in the 2026 federal budget, which translates to approximately 10,400 naira per citizen annually for over 2 million people. Therefore, over 70% of Nigeria's health spending is out of pocket, placing heavy burden on households. Wealthy Nigerians spend an estimated $1.1 billion annually on medical tourism, particularly to India, Europe, the Middle East, and the Americas. To revive the sector, the health insurance coverage should be extended to an estimated 83 million poorest Nigerians, which the WHO estimates to cost approximately 1.2 trillion naira annually. The states and local governments should strengthen over 30,000 primary health centers across the country, while there should be a shift to preventive care, which is more cost-effective. Emphasis should be placed on improving the welfare and conditions of service of health workers to halt the mass exodus of doctors and nurses. Regardless, negligence and misdiagnosis should have no place in the nation's health system, as doctors and health workers found complicit should face appropriate punishment. A compensation fund should be established to provide commensurable relief for victims, as statements such as "leave it to God" is a resigned proclamation that should not be encouraged. There should be provision of uninterrupted power supply to all the health facilities across the country to aid their operational activities. Therefore, sustainable clean energy for 30% of hospitals in the country by the end of 2027 should be vigorously pursued.
The script on addressing medical negligence was written by an intern from the University of Ibadan, Oyo State, Mercy Elam, and read from our studios.
The European Union has partnered with the Sokoto state government to launch a new child-sensitive social protection model designed to improve targeting, data quality and access to essential services for vulnerable households across the state. The initiative is funded through the 14 million euros social support for social inclusion program and is being implemented by UNICEF and the International Labour Organization to strengthen Nigeria's social protection architecture. Speaking at the launch in Sokoto, UNICEF Deputy Representative Ms. Ronk Khan said Nigeria had made important progress in building social protection systems, but noted that child poverty remained vast and multidimensional. Ms. Khan noted that under the new model, the National Social Register would incorporate expanded indicators on out-of-school children, nutrition, health insurance coverage, birth registration, zero-dose immunization, and vulnerability to shocks. She stated further that the deliberate focus on high-poverty LGAs reflected a strong commitment to inclusive and shock-responsive system. Sokoto State Governor Alhaji Ahmed Aliu reaffirmed the state government's commitment to pioneering innovations in social protection and pledged sustained support to ensure the success of the model.
The National Agency for Food and Drug Administration and Control, NAFDAC, says it has begun enforcement on the ban of production and sale of alcohol in sachet and PET bottles below 100 milliliters. The Director General of NAFDAC, Professor Mojisola Adeyeye, made this known during a media parley in Lagos. Professor Adeyeye stated that the agency had gotten a marching order from the Senate to enforce the ban, noting that the agency took the decision to safeguard public health and protect vulnerable population, particularly children, adolescents and young adults, from the harmful use of alcohol. NAFDAC boss noted that the proliferation of high alcohol content beverages in sachet and small containers had made such products easily accessible, affordable and concealable. NAFDAC had announced enforcement of ban on the production and sale of alcohol in sachet and PET bottles in November last year, announced in line with the directive of the Senate. The proposed enforcement was however halted after the federal government called for immediate suspension of all action and measures related to the proposed ban, pending the outcome of consultations and final directive.
The recently implemented 7.5% deduction by your state health insurance agency, OISHA, scheme for civil servants has been described as an avenue for quality healthcare coverage for workers in the state. The Executive Secretary of the agency, Dr. Olushola Akonde, stated this while receiving executives of the Radio, Television, Theatre and Arts Workers Union of Nigeria, RATAU, or your State Council, on a courtesy visit led by the chairman of the union, Mr. Kende Olayade, at the State Secretariat, Agodi, Ibadan. Dr. Akonde explained that though the scheme was opposed by some civil servants, the adjustment, according to him, was necessary to ensure better health care and wider coverage of enrollees in all sectors in the state. Dr. Akonde maintained that the deduction was not intended to punish workers, but to curtail some silent killer diseases such as blood pressure and diabetes among the state workers. In his address, the chairman, RATAU Oyo State Council, Mr. Olayade, appreciated OISHA for prioritizing the health care of workers, which he said aligned with the vision of the state governor, Engineer Seyi Makinde.
Members of staff of Radio Nigeria's Paramount FM Abeokuta have been reminded of the need to be more committed and dedicated to duty towards taking the station to an enviable height among its contemporaries in the state. The General Manager Paramount FM, Mrs. Oluremi Olugbenro, gave the charge during the maiden edition of the Staff Forum in 2026, which also features special prayers for the staff and station, as well as distribution of promotion letters to members. Mrs. Olugbenro, who appreciated the members of staff for their support and contributions to the development of Paramount FM last year, called on them to improve on their drive for internally generated revenue of the station for the betterment of the for the betterment of Radio Nigeria in general. She implored the staff to maintain love and harmonious relationship with one another to promote efficient service delivery of informing, educating and entertaining the team and listener of the station, promising that the management will prioritize their welfare and ensure conducive work environment. Responding on behalf of the promoted staff, Mr. Bukola Olaguju of the Admin Department thanked the management of FRCN for finding them worthy of the elevation and promised to reciprocate the kind gesture with hard work and dedication to duty.
Ogun State Government has launched a first-of-its-kind artificial intelligence-powered teaching and learning platform as part of efforts to reposition its education sector. The initiative, known as the Ogun Learning Enhancement and Academic Resource Network, Ogun Learn, is designed to modernize classroom instructions and prepare learners for 21st century demands. Radio Nigeria's correspondent Abimbola Bangboshe brings details.
State Governor Prince Dapo Abiodun officially unveiled the AI-powered platform at the June 12 Cultural Center in Abeokuta, describing it as a bold and deliberate investment in the future of the state's children. Governor Abiodun said Ogun Learn provides curriculum-aligned lessons resources, interactive learning support for students, and a digital platform that enables teachers to plan lessons, assess learners, and track performance more efficiently.
As the education capital of Nigeria, today is not merely about launching a digital platform. It is about foresight, innovation, and deliberately preparing our children and our youth for the future and not the past.
Governor Abiodun explained that the initiative goes beyond content delivery as it is designed to promote creativity, critical thinking, accountability, and lifelong learning skills among students. Prince Dapo Abiodun noted that the platform is part of the state's broader education digital transformation agenda, which includes initiatives such as Ogun EduCash, Ogun Scholar, Ogun Teach, Ogun Skills Fund, and Digital Platform for Education Revitalization. Also speaking at the event, the Commissioner for Education, Science and Technology, Professor Abayomi Arigbabu, said Ogun Learn builds on the state's successful use of technology during the COVID-19 pandemic to ensure uninterrupted learning.
As we launch this artificial intelligence-powered learning enhancement and academic resource network, which is second to none because of what that particular platform has. And I assure you that people will come down here to learn what we are doing with this AI-powered network.
In his remark, the chairman of the State Universal Board Basic Education, SUPEB, Mr. Olalekon Ifede, described Ogun Learn as the future of education delivery and urged teachers across the state to fully embrace the platform.
Our head teachers will be able to access this platform so that they can work, on trying to prepare lesson notes. They can access the lesson notes from this platform. And I'm telling you that what you are accessing from this platform is nothing but the best.
Mr. Ifede added that exposing learners to artificial intelligence would help build a workforce capable of competing globally and attracting high-value investments to the state. From Abeokuta in Ogun State, Abimbola Bangboshe, Radio Nigeria.
The federal government has announced plans to abolish the long-standing higher national diploma HND dichotomy by empowering polytechnics to award degrees. The major reform aimed at repositioning technical and vocational education as a driver of national development. The Minister of Education, Dr. Tunji Alausa, stated this in Abuja while addressing a high-level retreat of council chairmen, commissioners of education, rectors, registrars and bursars. Describing the move as a landmark policy shift, the minister said it will end decades of discrimination against polytechnic graduates and elevate polytechnics into centers of excellence within Nigeria's higher education system. He noted that Nigeria's future competitiveness depended on a workforce equipped to create, build and solve real-world problems. The minister explained that the policy aligned with President Bola Tinubu's renewed hope agenda, which prioritized job creation, industrial growth and human capital development.
This is the world today, the stories that made the headlines. Experts identified staff shortage as cause of medical mishaps. Still to come, police have apprehended teenage armed robbery suspect in Oyo State. Experts interim Venezuela leader plans to visit U.S. Military intelligence cautions against drones drifting to Finland. The details shortly.
Yes, on to the news on Premier FM 93.5. The news continues. The Oni of Ife, Oba Adeyeye Ogunwusi, has expressed appreciation for policies aimed at strengthening migration management, border governance and service delivery within the immigration system. Oba Ogunwusi made the recommendation when he visited the headquarters of the Nigeria Immigration Service in Abuja to renew his diplomatic passport. The monarch was received by the Controller General of the Nigeria Immigration Service, Kemi Nandap, alongside members of the service management team. He commended President Bola Tinubu, the Minister of Interior, Dr. Olubunmi Tunji-Ojo, and the Controller General on the transformative policies under the renewed hope agenda they implemented at the Nigeria Immigration Service.
The Nigeria Police Force, Oyo State Command, have arrested 3 suspected armed robbers and recovered a locally fabricated firearm during a routine stop-and-search operation within the Ibadan Metropolis. The arrest was carried out by operatives of the Command's Operations Department as part of ongoing proactive policing measures aimed at curbing crime and improving public safety across the state. A statement issued by the Police Public Relations Officer, Mr. Olayinka Anyolade, indicates that the suspects were intercepted while riding in an unregistered commercial tricycle, popularly known as Keke Marwa. The statement notes that the search led to the recovery of a locally made single-barrel gun modified into a short arm for easy concealment. The suspects, identified as Abdurrahman Rashid, Biodun Fatai and Muiz Salahuddin, all aged between 18 and 19 years. Mr. Olayinka said the Commissioner of Police, CP Femi Aruna, has directed that the suspects and the recovered firearm be transferred to the Command Monitoring Unit for discreet and intelligence-driven investigation. According to the police, the suspects confessed during interrogation to their involvement in several armed robbery incidents in Ibadan and other parts of Oyo State, admitting to snatching mobile phones, motorcycles and other valuables at gunpoint. The police said the suspects are currently in custody and will be charged to court upon the conclusion of investigations, while urging members of the public to continue to support security agencies with timely and credible information to enhance public safety across the state.
Similarly, the police command in Oyo State have arrested 3 teenage members of a crime suspected of being behind the series of armed robbery incidents across Ibadan Metropolis. In a statement signed by the command's public relations officer, Mr. Anyola Olayinka, the arrest took place during a proactive stop-and-search exercise by the command's operation department.
And now to the foreign scene. Venezuela's interim president, Delcy Rodriguez, will soon visit the United States. Report says she will be the first sitting Venezuelan president to visit the United States in more than a quarter century, aside from presidents attending United Nations meeting in New York. The invitation reflects shifts in relations between Washington and Caracas since U.S. Delta Force operatives seized President Nicolas Maduro and sent him to a U.S. jail to face narco trafficking charges. Rodriguez was a former vice president and longtime insider in Venezuela's authoritarian and anti-American government before becoming interim president.
Turkey, Saudi Arabia and other predominantly Muslim countries have accepted U.S. President Donald Trump's invitation to join the so-called Gaza Board of Peace. The foreign ministers of the 2 countries, as well as those of Jordan, Indonesia, Pakistan, Qatar and the United Arab Emirates, announced in a statement that their countries shared decision to join the Board of Peace. The United Arab Emirates, Egypt and Pakistan had previously announced their participation separately. Ministers reaffirmed their country's commitment to supporting the implementation of the mission of the Board of Peace as a transitional administration in the Gaza Strip. They said the mission is set in The mission is set out in the comprehensive plan to end the Gaza conflict, and it is endorsed by the United Nations Security Council resolution.
The head of the Nordic country's military intelligence service says the risk of drones drifting into Finland was as a result of the war in Ukraine. Report says Finland's security situation has deteriorated since Russia's invasion of Ukraine began in 2022. But the intelligence agency noted that the situation had remained largely unchanged compared to a year ago. Chief of Finnish Defense Intelligence, Major General Pekka Tirinen, said one concern highlighted in the report was the risk of long-range drones drifting into Finland.
And not end the news on the world today from the stable of Radio Nigeria. Here again are the day's top stories. Experts have identified staff shortage as causes of medical mishap. Oyo State Police Command has arrested 3 teenage members of a crime gang suspected of being behind a series of armed robbery incidents across Ibadan metropolis. Venezuela interim President Delcy Rodriguez will begin visit soon to the United States. Report says she will be first sitting Venezuelan president to visit the U.S. in more than a quarter of a century, aside from president attending United Nations meeting in New York. And lastly, was told you that the head of the nomadic country's military intelligence service says the risk of drones drifting into Finland was as a result of the war in Ukraine.
And that's it on The World Today. Join us tomorrow for a fresh edition of the program. Modupe Toba edited. My name is Stephen Agbaje. Thanks for listening. From my colleague
Remy Amolola, do enjoy the rest of the day. Good afternoon.